Okay, for our second program, Save Our Supplies. They create free medical supplies by repurposing clean hospital waste. Their collection bins in the operating theatres of Brisbane hospitals are used to collect clean, unused supplies and equipment that would otherwise be sent to landfill. Again, a rousing welcome for Save Our Supplies CEO, Claire Lane.
Hi everyone, thank you for having me. I think it's fair to say that Australia probably has one of the highest standards of healthcare, and it's something that you would want. I know it's something that I would want, but with these high standards, there's a very big problem that everyday people like you have no idea that is happening. And if I hadn't been working in an operating theatre to see it firsthand, I would not have known about it either. Now, I want to show you something. A bandage. Would you use this bandage? Yep. And what about you? You use this bandage? Yep. It's perfectly good. I've even got one in my own first aid kit. But the fact that it was clean and not sterile, in the bin, is what our hospitals did. To put it bluntly, we are throwing away $60 million worth of supplies every year. These are the type of supplies that are so dramatically lacking in under-resourced countries that it's contributing to people dying every day. The supplies are thrown away for a range of reasons. Sometimes there's really silly reasons, like the doctor doesn't like the fact that you've got two different colour bandages, so they'll make you throw away one of the colours so the colours of the bandage match. I know, it's absurd. The main reasons, though, are rigorous standards about sterility. And, of course, that sounds both logical and completely reasonable. We all want high standards when it comes to our healthcare. My issue that I have isn't choosing not to use it for surgery or operations or procedures here. My issue is the fact that we throw it in the bin. So I came up with a simple solution. For those of you that have ever worked in a hospital, you know it's an incredibly fast-paced environment and staff don't have time to go through and find the supplies and use what's used and what can't be. So we put a clean collection bin into high-traffic areas of the hospitals. They have a simple flow chart on the top so people can determine whether or not the items are usable for our standards. And it is not uncommon for us to collect one full wheelie bin of clean and usable medical supplies from a single hospital every 2 days. The impact we're having is life-changing. The first place we stopped was a maternity clinic in Papua New Guinea. This is a country where 580 mothers die in childbirth each year. Now, when I say maternity clinic, I mean they had a building, they had staff, but there was no real medical supplies there. Zero. So we fixed that and got them up and running with a clinic that their region so desperately needed. Another example is we recently sent supplies to Ukraine after the Russian invasion. As you can imagine, they were in dire need of medical supplies at that time, and we were eager to help. Importantly, we also support causes here at home in Australia when the need arises. In the height of COVID, we supported a Queensland charity that provides free healthcare for the homeless communities. We sent them 2 pallets of hand sanitizer and thousands of masks and gowns and gloves so they could keep their street clinics open and care for one of the most vulnerable Queensland communities. As well as the medical outcomes, we're also having a major environmental impact. We're saving hundreds of tonnes of unnecessary landfill going into our waste every year. Just last month, we saved 1.5 tonnes of clean and usable medical supplies, which we've valued at about $80,000. If you donate $100 to our cause tonight, based on our current experience, we will generate over $600 worth of clean and usable supplies. These supplies will be used in an estimated 400 patient interactions. For the supplies we sent to developing nations, $600 worth of these supplies will add 6 healthy years to that community. This figure has come from a recent McKinsey study. Again, $100 will add 6 years of healthy lives to these communities. Just so you know, the economic benefit comes from lower infant mortality rates and better, healthier working age people who are able to support their family. Thanks to you tonight, we can make a measurable difference in these communities, in Queensland and overseas, by collecting and repurposing perfectly clean and usable medical supplies. The solution is so simple, and it's as easy as a bin. I'm not done. We have our bin coming, they're just a little bit slow, so sorry for the preemptive finishing. Yes. Well, thank you for having me, and your help today will help us help many other people around the world. And thank you for helping me share my story and about the small difference that we're trying to make in the world. Thank you.
Thank you, Claire. And we're not.
Yeah.
Good. Okay. Questions? Yes. From the audience. Anyone got a question that they would like to present to Claire about this incredible... How did she make such beautiful children is one of them, perhaps. Oh, my goodness.
You got to put them to work young.
Yeah, absolutely. Maybe they could be cleaning, yes.
Yes. The bin will be cleaned too before it goes back to a hospital, just for the record.
Any questions from our audience this evening? Yes, over here there's a couple. We've got one here and one up the front as well, Kristen.
Sorry, I had a question about acceptance by hospital staff, including doctors. How generally acceptable is this concept to them?
Yeah, that's a good question. It has been taken up very quickly. We did start back in 2012, but I was living in a granny flat and at uni and everything and had the young kids. So in the past couple of years, sustainability in healthcare has really come to the forefront, and people seem really eager to want to help.
Affirmed here by our young friend.
Indeed.
Agreeable. Kristen, there's one just here, this question.
Claire, can you tell everybody how many countries you think is affected by your new activity?
Yeah, I think we're up to about 16 countries maybe now. I think my advocate will be able to give you a little bit more information on that, but they've gone to countries such as Papua New Guinea, Solomon Islands, Ethiopia, Cambodia, Ukraine. I could keep going, but I probably don't have time.
Incredible. Probably time for one more just over here as well. Microphone is finding your way. Isabel's just behind you.
Claire, how many hospitals are you working with here in Queensland?
Currently, we're up to 16 hospitals, and we have actually just been awarded a position on the Queensland Health's waste removal tender. So that's going to help us go into the public hospitals, which have a bit more bureaucracy and red tape than the private hospitals. So we will be able to start charging a little bit of money, which will be helping us as well to make a bigger impact.
I have a question. How cool's your mum?
Very.
And you concur?
More than I can explain.
Oh, that was really good. Well done. Thank you so much. Congratulations. Thank you for your work. It's incredible.